Lupus LA would like to thank our generous sponsors for their support of the Your Story, Our Fight podcast. We thank GSK for their focus on autoimmune disease and their continued support of Lupus LA. Hello and welcome to another episode of the Lupus LA podcast, Your Story, Our Fight. I'm your host, Adam Selkowitz, and as always at the top of the show, I want to thank our sponsor, GSK Pharmaceuticals, for allowing us to tell these incredible lupus stories. And we have a really interesting story today. Joining me is Dr. Katherine VanHise. Dr. VanHise is a OBGYN resident at Cedars-Sinai, and I think her story is really interesting, but also her insights into fertility and OBGYN issues for lupus patients will definitely come into this conversation. And but I think her diagnosis story is also really pertinent to our audience here. So hi, Katherine. Thanks for joining us.
Hi, Adam. Thanks for having me.
Of course. So tell me a little bit about, I always like to know, because I have a daughter who is 8 and I already wants to be a doctor. I assume, did you sort of have this, tell me a little bit about how you grew up and your interest in medicine.
Yeah. I was always interested in science. Both of my parents are engineers. A lot of my family are engineers. Nobody's in medicine. And actually my grandfather is like, no, you should go to med school. That would be a smarter career choice. And I listened to him because he was a great role model. So that's how I found my way to medical school. I ultimately decided on OBGYN because I wanted to help take care of women first and foremost. And then it was this beautiful blend of office medicine, surgery, inpatient medicine. And it's what I found myself loving the most. So that's what brought me out from the East Coast. And I completed my residency at Cedars in OBGYN in 2022. And I'm finishing up my fellowship now, also at Cedars in reproductive endocrinology and infertility. So year 7 of 7.
Wow.
Done.
Yeah, it is a long road. That's what my 8-year-old keeps asking me. Like, wait, how many years do I have to do? You know, all that. But
a lot, but
yes,
it's worth it.
Yes. That's what I keep telling her. So tell me a little bit about where in your story did your lupus symptoms start to present themselves?
Really dramatically right as I was graduating from my residency. So I graduated residency and turned 30 within the same week. And the same week as that, I started having crazy swelling, first in my abdomen, pelvis, and then both legs. I gained like 25 pounds in a month of swelling. My shoe size went from a 7.5 to a 10. And that was like the main, like, oh my gosh, this is obviously something very wrong. I think back to residency and maybe there were some symptoms I just ignored. You know, I think the fatigue and brain fog part of it, I just was like, oh, I'm a resident. Like we're all sleep deprived. We're all tired all the time. And it really wasn't until much further down the lupus journey when I actually started treatment that the medicine started working and this brain fog just lifted. And I was like, oh, I don't think that was normal. But nothing really prompted me to seek care except for the swelling that started so dramatically right as I finished.
Now, do you think that, obviously, I mean, almost everybody I talk to on this podcast can go back to kind of an inciting incident of stress that kind of releases this. I mean, I assume while it was exciting to be finishing the residency and turning 30, and I assume that few weeks in there was pretty hectic.
Yeah, I think that the stress that built up over the 4 years, and then in your final year of residency, where we consider ourselves like chief residents. So you're, in charge of teaching the junior residents how to do things. You're doing all of the complicated cases, surgeries, and ultimately a lot of responsibility falls to you. So it's a stressful year. I think everyone that's been a chief resident can agree. I think that the culmination of that year is just really what set me over the edge in terms of the triggering event. And I also was really sick. I had maybe COVID. I'm not sure. It wasn't clear at the time, but I definitely had some very sick illness right before I graduated also. So I think all of it together was just like this perfect storm.
Now, here's the interesting part of your story that I think, as bad as it was for you, I think it's going to be really helpful to our audience, because here you are, you're at one of the best hospitals in the world. You just have gone through medical school and residency. And tell me a little bit about how hard it was for you to get this diagnosis.
It was challenging. um, yes, much more challenging than I would have ever imagined, much more challenging than I wish for anyone else out there. I think it's a theme, like you've mentioned, and have had other guests on the podcast, like the delay in diagnosis. But even being at the institution where I trained, I was still an employee here. I was still a trainee here. Um, I just was seeing so many providers, over 20 before I actually got the diagnosis, like so many subspecialists, second opinions. I left LA and saw a second opinion in Northern California. And it was eye opening, and I honestly don't know how I would have navigated it had I not known this healthcare system. And
Mm-hmm.
I think we have room to improve.
Yeah, I think so too. I mean, obviously, your symptom is not sort of the first symptom on the list when you're looking at lupus, and so I understand. I don't think that. And I think this is true in a lot of cases. I don't think it's necessarily that the providers are bad. It's really just lupus is such a weird puzzle. Then everybody comes at it from this different angle. And it really does take somebody to kind of go, wait, step back. Let's look at this holistically. And I think that's where I think the subspecialty aspect of it is always a little dangerous, because people come in and they say, oh, you're coming here because you have an issue with your heart. I'm going to focus on your heart. And to look at a patient globally, to me, I think that's where the miss happens, and not just, I think, across the board. Because it seems like when somebody then goes to a rheumatologist, generally they say, okay, let's look at this from a different angle. And a lot of rheumatologists miss stuff too. But so tell me kind of, I mean, this is all seemingly happening fairly quickly to your body. Were you hospitalized at all, or was it that, or it just sort of is more subtle, or?
It was pretty dramatic. But like the things that you would expect to also be positive with a lupus finding of this much edema was my kidney function at the time was fine. I mean, it since has been elevated, the creatinine, but that was a later development. So there was nothing that warranted hospitalization. Interestingly, I had surgery within the first month of it because I saw a vascular surgeon, and we determined that I had this weird anomaly with my veins and my pelvis called May-Thurner syndrome. So I had a stent put in, and this was the same week I was taking boards in the first month of my new job. So again, like a lot of stress happening. And so then the stent went in and it got worse. So we were like, well, clearly this was not all just this May-Thurner syndrome. There's more to it. And I then saw a plastic surgeon because they specialize in lymphedema, because we were kind of just like looking for answers, like what is this edema? And went down that whole pathway. And ultimately I was getting physical therapy with lymphedema specialists like 5 days a week. And they were like, Katherine, you should be hospitalized. Like, this doesn't seem normal. But no, I was not in the hospital except for one day. But that's it.
And how does this affect you mentally in terms of, what's your mindset as you're both a patient and a new doctor or a new fellow? Where are you mind wise?
I think that's evolved a lot over the last 3 years. I mean, I hate to say I'm grateful for the experience, but in a lot of ways, like I've learned so much about medicine. I've learned so much about myself. And being a patient is really hard, like really, really hard. So it was very challenging to navigate as I was learning a new skill, a new job. But I think ultimately I'm a better physician for it.
Yeah. I mean, that quote, being a patient is very hard. We're going to use that everywhere, because it really is. And I think a lot of doctors don't necessarily understand that, but a lot of family members and friends and, it really, and it's a job. I mean, being a patient, especially when you don't have a diagnosis,
Yeah.
is a job. So tell me sort of where the change happened, like who had the light bulb go off, and how did that transition occur?
It was 15 months into the whole thing. I had seen, like I said, so many providers, and honestly, the only thing at that time that was positive lab wise was the ANA was elevated. And so we just were trying empiric things. And, I think ultimately I found an amazing rheumatologist who we did a lot of shared decision making. I think that's a big takeaway for me as a provider, and something I would encourage my fellow providers is it's always shared decision making, right? And so I think of all people, I really did understand the risks of just trying medication just because let's see what happens. I didn't meet any of the formal diagnosis criteria at that point, but the double-stranded DNA antibodies came back positive 15 months into the whole thing. And I remember him calling me so vividly and being like, it's lupus. And I was like cheering because I finally had a diagnosis, and I called my friends and my mom and my dad and my boss, and we were all literally celebrating that there was an answer. And I think that's such a weird place to be as well. Like being undiagnosed with no plan, no treatment, no clue is way worse to me, at my experience, than having a diagnosis, because it just opened the opportunity for actual treatment.
Yeah. And less, I'm sure in your mind, especially as a physician, you're trying to figure it out all the time. Also, you didn't just have 20 doctors, you had 20 doctors and you full time living with the symptoms. I can't, I mean, I'm not a doctor, but I get a symptom and I look it up, and I do all the wrong things that I tell people never to do. But in your position,
I was very frustrated with myself that I couldn't find the answer. I was very frustrated at the time with Western medicine in general, that I just felt like I had reached the limitations of what we knew and what we were capable of. And I was having, like, honestly, a little bit of a personal and a professional identity crisis. I was like, oh my gosh, like, that we're failing patients. But I've since readjusted how I view that. And, we were doing the best with what we had. My body was doing the best with what it was trying to do at the time. And ultimately, the symptoms, then the more classic lupus symptoms started around then, right? So like the malar rash. I actually had a rash that we biopsied that was lupus. And then the joint pain and everything else that went along with it, not just the swelling. So it kind of presented with one very dramatic finding, but the other ones have made their way in there as well.
Tell me a little bit about, you get the diagnosis, you start treatment. How fast was it before you started feeling better? And do you think that the stress of not knowing what you had, that going away, impacted your recovery?
I'll start with the second question, because I do think it did. And I think, before the diagnosis, when I really had tried everything under the sun that Western medicine could offer, I dabbled a little bit with like acupuncturist, Ayurvedic medicine, just to like get other perspectives. I've continued on with the acupuncture, and I think that just sort of mindset in general has helped a lot with healing, in terms of letting go of the stress, letting go of the anxiety of the diagnosis itself. But I do think the medication obviously really changed my life. So we started with the Plaquenil, and it was about 6 weeks that I suddenly, like I mentioned in the beginning, like this brain fog just lifted. And I was like, oh my gosh, this feels so good. And I saw my rheumatologist like 3 or 4 months into the Plaquenil, and he's like, this is good, but we can do better. And so then we ultimately started another medication. So I'm currently still on the 2 of those and continue to see improvement.
And your primary symptom, the lymphedema, that must have been so uncomfortable that I assume correcting that was a big relief.
Yeah. I mean, the edema, it was really profound. The things that go along with it, like when it was so uncontrolled, the swelling was bubbling up through my skin. I was having like blisters and lymphatic fluid was draining out. And that was like unbelievably painful. I remember being at work and like crying in the bathroom, and the MA was like, you need to go home. And I was like, I do need to go home. You're right. Like, thank you for giving me the permission to go take care of myself. Because I think as physicians, we struggle with that. But yeah, I mean, I obviously physically am lighter. I feel lighter. I no longer have to deal with foot sores and all of these things. And yeah, lymphedema is a crazy thing because there's really no one specialty that owns it. So I think that's also what sort of complicated my story and delayed the diagnosis. Like vascular surgery, cardiology, plastic surgery, like nobody really, I don't know, in different institutions, it's treated differently. So I think that was a challenge to find the team that fully understood what was going on, and then how it was related to the lupus took a while to get figured out.
And when you started on your path to recovery, did that change your, not attitude, but your experience at work and your experience with your fellow physicians, and how did that impact you?
I mean, I was happier.
Right.
And like I felt better. Like,
makes sense.
Yeah, I think the people that knew me well could see that I was struggling. But I think as with a lot of professions and just people, like we always show our best face in situations where it matters, right? So I would go to work and I would have my legs bandaged up like huge balloons, and I would like look pregnant, and I would do it with a smile on my face, and I was dying inside. But it wasn't until I started getting better that like the real spirit and joy and like my personality came back. And then I think people realized, oh, wow, you really were struggling. So yeah, I really was. But I think I just have a whole new appreciation for medicine and for life. And I think that the people that I work with have seen that.
Excellent. I mean, I love this story. So why don't we do this? I'm going to take a break, and then we'll come back after the break and we'll talk a little bit about fertility and what you've learned in there, and as it relates to lupus patients, of course. And so we'll be right back after this break.
Please visit our online store at lupusla.org. By purchasing Lupus LA products, you are directly supporting lupus patients and their families. For more information, visit lupusla.org.
We are back on the Lupus LA podcast, Your Story, Our Fight. We're talking to Dr. Katherine VanHise. And before the break, we were talking a lot about your diagnosis. Tell me a little bit about, because you're in this field of OBGYN, of fertility, what you've sort of learned in terms of, I know a lot of lupus patients are diagnosed in and around pregnancy and that time of their life. What do you think is important for lupus patients to know before they get pregnant about what their experience may be?
Yeah, I think that's a great question. Hopefully if they have a diagnosis, hopefully they have rheumatologists that they like and OBGYN that they like and trust. The pregnancies are at more high risk for certain things, both for the mom and for the baby. So we do like patients ideally to be in a place where their disease activity is pretty well controlled. So not in a flare and suddenly pregnant would be ideal. But of course, things happen. So we really do monitor you a little bit more closely throughout the pregnancy. We would generally refer you to our high-risk OB doctors, the maternal fetal medicine specialists, for closer surveillance. And I think it's an individualized conversation based on like a person's lupus presentation, what everything is going on with them in their history. But we have a lot of moms who come home with very healthy, happy babies, and they leave the hospital healthy themselves. So it's definitely possible.
And from what I understand, a lot of times the lupus will actually, during the pregnancy, fade away, right? Is that I don't know if that's scientific fact, but that seems to be what happens a lot.
It can for some patients, and for some others, it can actually worsen. A lot of times if patients have pre-existing like kidney dysfunction with the lupus, that could get worse in pregnancy, or it could predispose them to like preeclampsia, which is something that we really look out for. But others, might feel better.
Mm-hmm. And do you think that being a lupus patient, I always think being a lupus patient, most lupus patients are so in tune with their bodies. Do you find that they learn more about their lupus when they go through a pregnancy, or do you think that it's more of this sort of temporary world that they have to live through and come out the other end?
I haven't thought about that. I would be curious to ask a lupus patient who has been pregnant. But I would imagine that, they probably do learn a lot more about themselves and their bodies. And to your point, yes, having lupus now, it's like, oh, I ate something that my body doesn't agree with. I know immediately, or, I have come to learn the triggers, which is nice because I can avoid them. But certain things, obviously, with being pregnant, you may or may not be able to avoid.
Mm-hmm. And tell me a little bit about the fertility aspect of rheumatology patients, lupus patients, and how does that come into play?
Yeah, I think there's a lot of room for ongoing research. I think both in rheumatology and in fertility in general. But I think the classic thing that we're taught and we think of is the cyclophosphamide that can be used to treat lupus. It is potentially toxic to the ovaries and can cause what we call diminished ovarian reserve, where your egg count or your egg quality is lower than we would expect at your given age. So that's something that we think about and we do see. In terms of planning fertility treatments, again, it's a coordinated effort with the rheumatologist and the fertility specialist, but most of our treatments, I would, I guess, argue all, but you should never really say all, but it is safe, like egg freezing, IVF, intrauterine insemination, all of those things we do for lupus patients often. And they may or may not need extra medication like a blood thinner, depending upon their situation, but that's something that is individualized.
And I would assume particularly anybody who is going to start the chemotherapies, the Cytoxins of the world, having those conversations, if you're a young woman, even pre where you would think about, in a relationship or having kids or whatever, but what do you recommend in that scenario?
We would talk to them about egg freezing, if they're interested, if they have the time that them and their rheumatologist find that, we can spare 2 or 3 weeks before we start this medication. It's similar to the patients that we see that are referred from oncologists for cancer, like any chemotherapeutic or any drug that can be toxic to the ovaries. Freezing eggs beforehand is a really great idea.
I actually, my wife and I went through fertility issues because I did a round of Cytoxin and we did the same thing. And obviously not with her eggs, but on my side of the fence. And we spent a number of years working to have kids. She doesn't have a rheumatology issue, but she had other challenges along the way. And I was convinced that having had lupus for 20 plus years, all the medicine I've taken, all the stuff that I've done, that I was going to be the primary problem here in this situation. And it turned out I wasn't, but it was actually really good that we were able to kind of think about it ahead of time because we started the process a lot earlier.
Yeah, I think that's a huge benefit for fertility preservation in general. And then certainly, hopefully, if someone is doing it before a medical treatment or something like that, it can alleviate some of the stress that goes along with that whole process.
So now that you're finishing up your fellowship and moving on to private practice, what do you think? Do you think your diagnosis of lupus will impact kind of the cases that you want to see or the people that you want to treat or the research that you end up doing?
I mean, yeah, I'm very passionate about this. Obviously, lupus, rheumatology, the intersection of reproduction and immunology, there's just so much we don't know. And I would love to keep learning. And I'm a lifelong learner, keep doing research. I would love to take care of patients that may want to come see me. I think, it really, my experience, and like I commented earlier on being an undiagnosed or unexplained patient, it was really, really hard. And so many of our patients in the fertility world now we don't have an answer for them. We say, oh, it's unexplained, meaning like it's not obviously just the sperm or the tube or the eggs. Like it could be a combination thereof, or even if all three of those are seemingly okay, it still might not work. And I just want those patients to know that I feel your pain and I'm here for you. But there's so much to be learned, because unexplained to me for 15 months felt unacceptable as a diagnosis. And I worked really hard to advocate for myself. And I hope that patients, continue to do that in their fertility journeys as well.
Well, I can't imagine a lupus patient in California who's thinking about having kids, who's not now thinking about coming to see you, because obviously I think that makes total sense. And I think the empathy part of a physician's practice is so important. Mm-hmm. An understanding of what a patient is going through, to me, totally makes you a better doctor and a more effective doctor.
Thank you.
Yeah, no. And I thank you very much for sharing your story. I know you're going to be doing some other work with Lupus LA, and we're so excited to have you on the team, and wish you great health and great success in your next chapter.
Thank you, Adam. Yeah, I guess just one last piece of advice that I've learned is just maintain hope. I really struggled with that at times. And when I found that I didn't have hope for myself in my journey, other people stepped in and provided it for me. And I think with fertility patients, it can be a very long journey. It can be very challenging. It can feel as though there is no hope. But I remain optimistic for my own health. And if you don't believe in yourself and your ability to get better, like ultimately no one else is going to believe you either. Right. So yeah. I just really hope that people maintain the hope.
Yep. No, I have two beautiful kids that were a direct result of maintaining hope. And so I totally know what you mean. And I think you're absolutely right on both the personal rheumatology side and the fertility side. I think I couldn't agree more. Attitude is so much a part of healing.
Mm-hmm. Yeah.
Excellent. Thanks so much, Katherine.
Thank you, Adam.
On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.